हाँ अब आ गया ना, हाँ ठीक है. So I'm Dr. Praveen Tripathi, and with me, of course, is the legend himself, Goga sir.
Hello everyone, this is Dr. GRG.
So students, we thought of doing this session because NEET PG exam has gotten delayed, and we thought that let's talk to the students and let's discuss what strategies should be followed now that the exam is on 30th of August, and what should we target first. So Gobind sir, I think it's a wonderful opportunity for everyone, whether the preparation was going according to plan or whether somebody was just starting with the preparation. For both groups of students, it's a wonderful opportunity for the simple reason, sir, that if somebody's preparation was going out according to the plan, so the doubt was, should I focus on INI-CET? And if I do that, would my NEET PG preparation suffer because there is slight difference? But now that the NEET PG is in August 10, one can, whose preparation was going fine, he or she can solely focus on the May examination, and there is no conflict now. What do you think, sir?
Definitely, it's a good opportunity. But one thing only the student need to keep in mind, I'm very skeptical about that. In the advertisement, they have given the named as tentative date yet. So I'm not sure whether it will be August or maybe even one more month student will get.
Yeah. So hopefully that doesn't repeat, sir. Last year there was whole drama of postponement, preponement, फिर postponement. So let's hope this time August 30th it is.
So
So sir,
basically, the
हाँ,
NB, they are saying that the NEET PG exam, as we all keep on saying, is not only the test of your knowledge and the fact remembering, but it is also the test how resilient you are.
हम्म,
आप इन पोस्टपोनमेंट से कैसे जूझ सकते हो, वो ये भी
हम्म,
जानना चाहते हैं.
right, right. So, Jyari sir, I have prepared some slides for both category of students, those who are studying well, what should they do? And again, another wonderful opportunity is opening up for them who had yet not started preparation. Now that NEET PG exam is 7 months away, and 30th August, if we hope that NEET PG happens, right after that in November there would be INI-CET also. So two exams are coming up for them as well. So first, let us talk about the students for whom the preparation was going according to plan. So our clear recommendation is that target May INI-CET, right? As we said that there is no conflict with NEET PG now, so you can target INI-CET confidently, and we have enough time. We have 3.5 months left for it, right? Almost 100 days. 100 days is a good enough time. If you have done first fitting, if your preparation was going to at least some level, 100 days is a good enough time for you to plan, complete the course, and at least revise it twice. But INI-CET exam hoga sir tends to focus on certain topics. That is one thing. First prof topic, second prof topic, they do give a lot of importance to certain clinical questions. They do a lot of importance to. So our preparation has to be now catering to the INI-CET paper. And for that, what we are thinking is in Cerebellum, we are starting with a new END series. END is basically test and discussion. We call it exam and discussion. And we would also be helping with students with uh, the PYQs which were asked in the INI-CET and AIMS. So Gobind sir, this is the plan that we have created. So students, what we are thinking is uh, from today till exam, we have like 3.5 months. So let's divide it into 2 months plus 1 month plus 15 days. In the 2 month, we complete our first revision or first reading, whatever it is. In the next 1 month, we revise it. And the last 15 days, we again revise it, right? So these are the END dates that we are suggesting. Goga sir, for those who do not know what END is, could you please say a couple of lines, sir?
So END is basically the full form is examination and discussion. So it is a fancy word created by us for test and discussion. So basically it is a test. So you will get a test on the app. You will need to attempt the test, and then the faculty of that subject will discuss the questions. So they will discuss in detail what is the answer, why others are not the answer, and how to think about the question. Uh, Even in many questions, you can answer without knowing too much by ruling out the options. So that all will be told by the faculty. So
Hmm.
how to go about any question. So the purpose of basically TND or END is that you study yourself because your studies are going fine, and you just appear for the test your knowledge also, and also see where you are making the faults. That means whether you are not able to properly understand how to go about the question, or simply you are lacking the knowledge about that particular topic. So
Right.
that's the basic aim. So I feel 100 days are quite a good enough time for clearing any exam, particularly if you are on the track already, and focus for INCT without worrying that the preparation for NEET will be hampered, because we have sufficient time after INICET also.
Right. So students, this is the strategy, this is the schedule. So for example, we are starting from Feb 1st pediatrics by Dr. Anand, right? Now, today we are on 27th. You have gotten 28, 29, 30, 31st, right? So in these 4 days, you revise from whatever source you're using, or you read from whatever resource you're using, whether it is rapid revision from Cerebellum, whether you want to follow mission videos, the older videos, or even if you had followed some other resource, use it, complete the course on Feb 1st, do the live test in the app, and the questions that would be given would be all INICET focused or INICET based. Do the discussion and then move on to the next subject. So, as you can see, for shorter subjects like ENT, we have given 2 days or 1 day for forensic. For subjects like surgery, we are giving 6 days. So this whole schedule has been made keeping in mind what subject contributes to which subject contributes to how many questions and how many days do you need to complete it. One thing I want to point out is say before psychiatry I have kept 2 days, 23rd and 24th. But you don't need 2 days for psychiatry. Maybe 1 day would be enough. So that additional 1 day, maybe you can complete one system of medicine, right? But here we need to follow a basic framework that 2 months plus 1 month plus last 15 days. So this is the first phase, the 2 month. Once you reach April 3rd and your this first revision is complete, then we go to the phase two. Now what we are going to do? You are again going to revise from your resource, and we will have mini GTs in between. You can see roughly every seventh day you would have a mini GT that would cover 3 to 4 or 4 to 5 subjects. There might be some changes in the sequence, but mota mota hi rehne wala hai. So this month you do the revision. So mini GTs basically usually Goga sir, there are 100 questions, 90 questions, 120 questions. So again, to give a schedule that don't spend too much time on a single subject, but go to the next subject.
Uh,
After this, we will go to the phase three, where it would be merging with the marathon INI-CET. Goga sir, what exactly is marathon INI-CET?
so Dr. Praveen, I will come to marathon, but before that, there are some
Okay,
students who are asking some questions.
okay.
Students are asking one important question. If a student do not want to target INICET,
Hmm.
they directly want to prepare for NEET PG.
So
So,
I'll be coming to those slides after this is done. END, I have more slides. I'll show you. यहाँ से this is for NEET PG. So
okay.
please wait for some time. We'll be talking about that also.
Got it.
Yes.
So, students, please wait. If you are directly preparing for NEET, we have planned for you also. Yeah.
Right.
So, this is for those students who want to target INICET also and do not want that their preparation for NEET should be hampered also.
Hmm.
Yeah.
Right.
So, after phase two, so first we will have ENDs, subject-wise tests separately. Then
Hmm.
we in phase two we have mini GTs,
Hmm.
and then we will have marathon. So, what is marathon is basically in last 7 to 10 days we will make you revise all the subjects, theory of all 19 subjects by the subject specialist in a quick format. So like in 4 or 5 hours, I will complete pharmacology. So in last 7 to 10 days, you will be made to revise live by the faculty all these subjects, so that this act as a your final revision.
So students, many times we get this complaint that in the end days it becomes so overwhelming that self study becomes difficult. So what to do? And Goga sir, when we have interviewed even toppers, they say कि last में पढ़ाई नहीं हो रही थी, so I started watching marathon. So marathon is final revision with us. I mean, you ask a teacher like Goga sir that complete pharmacology in 4 hours. So you know that he would be giving you the most important thing that is likely to come in the examination, and so is the case with all the other teachers. So this is the plan for those who are preparing for INI-CET. Of course, we will have GTs. Now, by now, you guys know that before every major exam, we conduct 3 mock exams. Mock 1, 2, 3. One is of standard difficulty, 2 is of advanced difficulty, 3 is PYT based. The same thing we are going to do mock 1, mock 2, and mock 3. Of course, it would be a part of it. So in itself, it's a very complete program. And after the INI-CET is over, those students who are following this END batch, Many of you would get selected and would get out of this race. For others, you would continue with the END plan for the NEET PG, right? So it's going to go and get merged with the NEET PG preparation. So before we move to NEET PG questions, sir, do we have any other questions for this INI-CET
Sir,
batch, END batch?
Anmol is asking how to analyze GT fast. So Anmol, I think you have not seen the GTs we are giving since I think 12 months now. So in every GT of Cerebellum, there is a video-based discussion. So in around 2.5 to 3 hours, you can review whole of the GT with the respective faculty. So I think revision of GT has not remained a challenge now.
Right. Shivani is asking midday module and late night PYQs will be from end subject, which is scheduled as. Okay. So Shivani, late night PYQs. Now, since we would be having two batches going simultaneously, one focusing NEET PG, one focusing on INI-CET. So we will have two set of late night PYQs also. The INI-CET focused late night PYQ would be following this sequence, these subjects. So in phase one, they would be subject wise. In the phase two, they would become mixed bag. In the phase two, they will become mixed bag. So subject wise and then mixed bag, the way we did last year. Somebody is asking, sir, some of these classes are very passive and what can we do actively? So the thing that helps you with the active recall, we have already introduced it. It is flashcards. And we have been saying, I have said this, Goga sir has said this. For flashcards, if you're following the 2020 principle, you are going to do great in your exams. What is 2020 principle? 20 minutes in the afternoon, 20 minutes at night. You have to do two sessions of flashcards. In 20 minutes, most of the students are covering 50 flashcards. So in one day, you're covering 100 flashcards. So say you are studying pathology. You studied, say, general pathology on day one. Next day, in flashcards, go to the custom deck, choose the general pathology question and complete them. So, and flashcard is all about active recall, right? So rather than seeing four options, you would be asked, I keep on giving this example that if I ask you what is the drug of choice for treatment resistant schizophrenia, and I give you four options, clozapine, risperidone, haloperidol, chlorpromazine, you would mark the clozapine. It is easier. But if I don't show you the option and you are forced to remember it, it forces you to recall, actively recall, and that strengthens your memory. So active recall, evidence suggests that nothing is better than flashcards. All of you have access to flashcards, those of you who are mission students.
So another query, Dr. Praveen, that students are asking those who are already subscribers of Cerebellum Academy in
Mhm.
France, will this be available, END?
Yeah. So if you are a subscriber of either END plan or a mission main plan, you would get all of this. You don't have to buy anything. So whatever our students are, existing students are, we always provide these things without any cost or any other subscription. So you would get it. Somebody's asking what will happen to the batch two students. Yes. So see, batch two is going to end, I believe. And I'm yet to I'm yet to come to those slides, the batch three slides. I'll tell you what will happen to the batch two students. Anything else? Simran is saying our GT is also INI-CET specific. So Simran, as I said, some of the GTs would be combined, NEET PG plus INI-CET, but we would be having three mock GTs, which would be INI-CET specific. Ritik, I'll come to batch two. Please give me some time. All right. So now let's talk about the batch three. So batch three is for those students who are starting now, who have not been preparing till now and who want to start studies now and their preparation is yet to begin. So because the NEET PG examination is on August 30th, we have a solid 7 months for NEET PG and then we have around 8 months before we get November INI-CET. So for you guys, this is the most important thing. This is the biggest mistake students are making nowadays. The examination bodies are asking deeper question, conceptual question. Gone are the days when we could just look at the PYQ superficial things and get everything done. And Goga sir, just to put my point across, I have kept this question. This is a question from FMG examination January 26. Students, just look at this question. I was surprised to see this question in the FMG examination. A 30-year-old man living with family is hearing voices commenting on his actions for last 3 months. He says neighbors are spying on him through satellite devices. Which of the following indicates schizophrenia rather than delusional disorder? That is the quality of the question that they are asking now. Gone are the days when they would ask what is the duration criteria for schizophrenia. Gone are the days when they would say that these two are the symptoms, what is the diagnosis? Goga sir, now they're asking how would you choose schizophrenia over delusional disorder? And sir, this is the kind of question that is given in UWord. I mean, in USMLE, these kind of questions are asked. So one thing is very clear, NBE is not playing according to the older rules now. They're asking difficult questions, and if they can give this in FMG, I mean in NEET PG, we can expect that deeper things would be tested. So students, remember this, concepts. Otherwise, what is going to happen? You would go in the examination and you would feel कि यार ये कहीं पढ़ा तो हुआ है. I've seen it somewhere, but कहाँ पढ़ा हुआ है वो याद नहीं आता है बच्चों को. Second thing, we have to ensure at least 3 or 4 revisions. That is a must. Goga sir, this thing that you always talk about. Students keep on doing classes, reading notes, but when it comes to GTs, doing MCQs, they are like, I'm not very sure, number kam aage to kya hoga. Sir, is this approach right?
Definitely not right. Particularly the grand test, they act as a final, not only assessment tool, because mostly the student think the GTs are assessment. Whether how
Hmm.
many marks you are getting, only that is the purpose of GTs. That is the least important purpose. Remember, GTs, whatever mistake you make, that will come in your brain that I have made this mistake. If similar question come in actual exam, you will never make that mistake. So
Hmm.
if you are worrying, you are frightened that I will get 100 marks out of 300 and you do not give the GT. So you are missing out on those opportunities because you will never come to know where you are making mistake. So in the
Hmm.
actual exam, you will make more mistakes. So the most important thing is do not worry about marks because किसी को जीटी के marks बता के क्या लेना है तुम्हें. हमें तो
Hmm.
एक्चुअल एग्जाम में मार्क्स चाहिए ना. अगर जीटी में जितने कम नंबर आएंगे जितना गलत होगा आपको गलतियां पता लगेंगी एक्चुअल एग्जाम में उतनी गलतियां कम होंगी. Clear?
Hmm.
So that is the most important purpose. You need to know where you are making mistakes. Second
Right.
important purpose of GT is that it tune your brain to sit for 3 hours continuously and think. Okay?
Hmm.
अगर आप छोटे छोटे एग्जाम दे रहे हो 3 घंटे लगातार बैठ के एग्जाम कभी दिया ही नहीं तो एक्चुअल एग्जाम में बाहर आके आप हमेशा बोलोगे कि आई हैव मेड मेनी सिली मिस्टेक्स. रिमेंबर नो मिस्टेक इज सिली. वो इसलिए सिली लगती है उस समय इसलिए गलत हो गया बिकॉज द ब्रेन हैज स्टॉप्ड थिंकिंग. Okay, so for that you need practice, and that is your GTs.
Right. And finally, follow a schedule. We have to have a plan from the very beginning that this is when I complete my first, second read, this is when I do my first, second revision, and this is what I do in the last days. All right. So for those of you who are asking the answer, the best answer is B, right? So in batch 3, what are we going to do? So of course, we want you to follow schedule or discipline. For that, we will have live online classes, right? Every evening, 5:30 p.m. Many of you know that we have live online classes. For those of you who are in jobs or who are interns, either you can watch the video of the live online class or you can also use the rapid revision videos of Cerebellum. But this is what we say. Even if you're watching recorded content, at least END try to do it live. Anyways, it starts at 5:30 in the evening. By that time, most of you are back from your job or hospital and be a part of the discussion, right? So, and this would also ensure that you are following the schedule properly. When you have these hard stops, na, that I have to complete this syllabus, the pharma by today, because today Goga sir is going to have his END. Then you start, following the schedule properly. So let it happen. We do have late night PYQs. We say that PYQs is something which is important. It tells you what kind of questions would come. And because you people tend to procrastinate till the end. So what we do is as test, we give it every night. 30 question, 40 question, 50 question. Do it. It is going to give you a lot of returns. Midday module, basically you all were always worried that what kind of tags should I use in custom module. We went to the teachers and asked them, you tell us what questions are important from your Q bank. And they gave us the questions and we created midday module. So midday module is basically a custom module created by the teacher. Flashcards we have already talked about. Whatever subject you are doing, do the flashcards of the same subject. We have around 10,000 to 11,000 cards. If you start doing 100 cards per day, in 100 days you would finish everything. Of course, there would be repetitions of the card. That is the whole purpose. But usually 40 minutes are enough to do 100 cards. It is a new thing that we have brought in the Indian segment. In USMLA segment, it was being used for many years. And if you simply do a Google and see whether flashcards helped in increasing USMLA scores, proper studies have been done that say 15 to 20% increase in score. Imagine your score getting increased by 50%. You were getting 140 correct and you got how much? 168 correct. Your rank would go from 5,000 to probably under 100. So this is a new tool. Whosoever uses it would have a beginner's advantage. Please do it. It's going to help you a lot. GT's Goga sir has already talked about multiple revisions we talked about. So for batch 3, the first phase is going to begin from January 29th and will go till May 2nd. It's starting with a pathology class by Dr. Spurs sir. So there would be a live class followed by a test and discussion and the midday modules and late night PYQs in sync. So we are going to have two sets of late night PYQs going side by side. One focus on INI-CET, other focus on the NEET PG. May 2nd, after that we'll have our marathon INI-CET, and then after INI-CET we go back to lab 2. Again we'll have live revision classes, again we will have tests and discussions, and now all of these things will become mixed bag. And finally we'll again have another revision in the form of marathon NEET PG. So students, everything is very well planned, and now we are in the third year of these things, so we know these things work very well. So you can trust upon these things. They'll help you continue with the schedule and they'll help you finish everything in time. So this is a details. And as you can see, bigger subjects are given 7 days, medium level subjects are given 5 days, shorter subjects are given 2 days. But this is how we complete it. Goga sir, this is something that you talk about all the time. Show up every day. So what exactly do we mean by that?
So that is the most important thing, because preparation phase is quite long. Like for NEET PG, we have around 7 months, and it is practically not possible to study each and every day, because some days there will be some problems. Maybe you will get fever, maybe you have some personal problem, maybe you are not, your brain is not ready to study. So some days will be there in which there will be some problem. But important thing is, instead of extending that period to a too long period, do not make that 5 day, 7 day period of not studying. So what we say is, even if you have some problems, you do not have any time, just show up for half an hour, maybe 1 hour. Okay? So just do something, but daily try to study whatever time you get. So that is very important, because if you take the preparation till last day, definitely you will get a very good advantage, and you will definitely score much better as compared to a long gaps in between.
Right. Live classes, we keep saying that for those of you who are struggling with discipline, live classes are a game changer. And even if you are busy, then at least watch the videos, at least follow the END schedule so that there is something that is keeping you accountable. So do the live class. At night, appear for the late night PYQs and the night session of flashcard. In the morning, revise using the notes, day session of flashcard and midday module. And when ENDs come, take the ENDs. Do the GTs, follow the labs. We usually suggest that you follow quick revision notes because they're more concise, but many of you are following mission workbooks. That is completely fine. If you miss a class, that's okay. The classes are recorded and you can watch them later. But as Goga sir said, even because of some reason you miss a class, don't stop following the schedule. Continue with the other classes. You will get lab 2 and lab 3. You will get the time to cover the backlogs. The classes are usually at 5:30 p.m. in the evening. And I mean, some faculties tend to delay it a bit if they are late from OPD, but that is usually told in well in advance. Guga sir, this is a question that sometimes come that I really like the schedule of Cerebellum, but 3 subjects I have done from some other resource. What should I do now?
So the most important thing is, if you are comfortable and you can finish the subject in the time given, like we have given 4 days, and you can finish from your source in the same much time. So you can do from that only. There is no problem, but you must attend the END live. That is the most important thing.
Right. If you are a BTR student, I don't think there's any difference. Again, we would say that you have to use deeper resources, you have to build concepts, and you can use mission classes or rapid introduce for the same. If you're a BTR student, we give a coupon code that we'll talk about so that you don't have to pay double the amount. So before we finish it, all right, I'll just show. So many of you are our students already. Those of you who are not can go to the site of Cerebellum Academy, go to the plans. And if you want to take END plan, this is what you have to take. And if you want to cover the complete plan, this is what you have to take. Now let us take the questions. Sir, so what should be the strategy for batch 1 students and batch 2 students? So if you're a batch 1 student, I would definitely say start following the END plan focused on INI-CET because your classes are over. You are done with the first read and first revision. This is the time to consolidate and go to the E&D plan. If you are a batch 2 student, your lab 1 would be ending somewhere in the beginning of March. I think this is the last class. Goga sir की class है, last class है. यहाँ तक you continue with the batch 2 only, and then you would be left with 2 months, 2.5 months. In that period, do the ENDs of INI-CET that would be done in the class, right? Recorded ones, do them. And finally, you come back for the marathons. So in the 1.5 month, you do all the INI-CET specific ENDs. And then finally, you join us back for the last 15 days for marathon. So batch 1, immediately jump to the END batch for INI-CET. Batch 2, continue as it is. Then you do the ENDs INI-CET focus, then come and join us back in lab 3. Right? Does that answer your question?
Yes. So one of the student is repeatedly asking how to review the GT. So although we have already answered, now let me answer in little detail. So where you have given a GT. So in GT, you have some questions which you already know and they are correct. There are some questions which are wrong and some questions which you have guessed but are correct. Ne? So those questions which you have guessed and are correct, or those questions which are wrong. First of all, see the video explanations of those questions. Ne? So you can skip the video explanation of the questions which are correct and you already know they are correct. Ne? So the questions which you have skipped, questions which are wrong or questions which you have guessed, see the video explanation which is given half a minute or maybe 45 seconds, maybe 1 minute maximum. Clear? If you are comfortable that you know the concept and little bit you have forgotten that thing, so do not go ahead. So just that is the enough thing. But those topics which you feel that you need little more knowledge, go back to the main videos or mission videos or from wherever you have studied. So spend around 10, 15, 20 minutes on that topic, not more than that. And again, come back to the another question. So your GT should be reviewed the same day.
Correct. Right. Any other question?
GT frequency at present, you can give GTs maybe once in 2 weeks. But as the exam approaches, try to make that more quickly and around one in a week.
Right. Nisha is saying ideal GT score, sir, after first read, there is no ideal GT score. The absolute score does not matter. What matters is whether you are able to improve or not. Also, please remember that in GTs, the improvement is not linear. It's not that GT1 you would be here, GT2 you would be here, GT3 you would be here. More often than not, it goes like this. You will not see any difference for many GTs, and then suddenly GT score will increase. And then there are fluctuations also. Sometimes it will decrease. What is important is that you peak on the day of exam. As Guga sir keeps on saying, it does not matter where you are in this graph during GTs. We have to ensure for a strong finish. That is the most important thing.
Just remember the GT scores are just like Sensex. They keep on fluctuating. So over a long period, definitely they will give you better results.
Exactly. How to do previous subjects along with the ongoing subject. Yeah, so see, this has been a classical problem for a long period of time, what to do with the previous subjects. And that is why we keep on saying that use flashcards now. See, flashcards work on the principle of spaced repetition. Whatever you did today, you will be shown the same thing on day 2, day 4, day 7, day 10. So say today I am sitting and maybe I read pharmacology 15 days back. The things that I was not able to remember properly would come in my deck today, in today's deck. So the whole problem of what to do with the previous subjects gets solved when you're doing flashcard. And the best part is you do not have to let go of anything for doing this flashcard. Sometimes you are like, if I have to do mission classes, I cannot do rapid revision videos. If I have to do Q bank, maybe I have to cut down on the classes. Here it is just an add-on. 20 minutes twice a day is like nothing, right? So that's also one of the biggest problem.
So Dr. Praveen, another question is, sir, mission classes are necessary or rapid revision with END flashcards are good to go?
So see, no, we would not say that mission classes are an absolute must, but we must remind you that data is pretty encouraging. Mission classes are around, sir, 400 hours of content, not too much, not too less. In last INI-CET, we had a 86% strike rate of mission classes and NEET PG 90% strike rate. So those students who could master those 400 hours could have gotten in rank 10, right? This is, and see, everybody says our strike rate is 100%. We don't say that. We say what we can show. And even if the strike rate is 100% with main videos, that doesn't matter. Very few people can complete 1,000 hour of content and review it. But if we are getting such high strike rates with 400 hour of content, and that to not condensed content. Guga sir, yesterday a student was messaging me कि sir, it takes me less time to complete 10-hour mission class than 5 hour of rapid revision. I said why? He said sir, rapid revision is recorded very condensed. In live class or even the recording of live class, teacher is teaching very slowly, answering doubts. So it is very easy to complete it.
Yes,
So that it
definitely.
is.
That will definitely happen because rapid revision, if you see it is highly concentrated, you have to pause at many times, try to imbibe the thing, and then you will go forward. So definitely, if rapid revision is of 2 hours, you will take 4 to 5 hours to finish that. But mission classes, if it is of 5 hours, you can finish in 4 hours near about.
Right. Uh, so we have answered this. Ayush Agarwal question on GT sir has already answered. Shubhraj Hai saying, sir, if someone not started today with fresh preparation, but already stuck for 1 to 2 months, what should they follow? See again, if you are stuck for last 2 months, then then I would say that go for NEET PG. Even if you are trying to get into INI-CET, 30th August is NEET PG. I think 7th November or 8th November would be INI-CET. So you can do both things together, right? It makes it easier. लोकेश इज सेइंग सर बैच वन के लिए ईएनडी कहाँ पर है मेरे पास ऑलरेडी सब्सक्रिप्शन है लोकेश एज वी स्टार्ट विद द साइकिल विल स्टार्ट सीइंग इट इन द ऑन द फ्रंट पेज ऑफ द ऐप इटसेल्फ Dr. Momo is saying, sir, please make some accountability program in which if anything is missed according to schedule, a small amount of monetary amount is detected as a fine. गोगा सर आप ही आंसर करो इस बात को तो
We will become millionaire with that method.
हाँ हम लोगों के पास बहुत पैसा आ जाएगा तुम लोग
So someone was asking the question, I think. एक मिनट क्वेश्चन था, I forgot.
Khushi is saying, sir, I've been using flashcard regularly. I suspended a few cards thinking I would be able to unsuspend them, but realized later on there is no option for that. Khushi, वो भी कर रहे हैं. We are making a library that will have all the cards that you have suspended, so you'll be able to see that.
Any offline batch in Hyderabad? बेटा हैदराबाद में तो चल रहा है offline batch. You can contact the person there.
Mahajan is saying, sir, GT score 90 correct. Should I do INI or NEET PG? Mahajan, see, I'll be very practical here. If your score is 90, perhaps you need more concept building, right? And even if you want to target INI-CET, perhaps targeting November INI-CET would be better than going for May. See, one mistake many students are doing is they are trying to memorize the same thing 3 or 4 times without understanding anything. It is not going to go into your head. You cannot rote memorize the entire 19 subject. That is a bad way of studying, right? It is a self-defeating thing. uh, Anyways, medical sciences is full of facts that you have to memorize. On the top of that, if you try to memorize everything, समझ आ रहा है नहीं आ रहा रट्टा मारो नहीं चल पाएगा ऐसा. So you have time, do the right thing. इतना आसान होता तो बात ही क्या थी.
Dr. Vishnu Dev is asking, sir, I have main notes and QR 1.0 notes. Will it work in batch 3.0 or I have to buy QR 2.0 notes? So, Dr. Vishnu, basically, I will want to say that do not try or keep on purchasing the notes again and again. You can add little bit of things which are missing in 1.0, or if there is something extra, you can delete that. So you have to do a little bit more hard work, but I don't say that all purchase again and again. So you can use the same.
Manas Manas Kamakshi Sharma. Sir, old mission subscriber currently following BTR cycle till 12th Feb. How can I start INICET cycle from Feb 1? I think the difference is only of 10 days. Either you can start from Feb 1 and follow it, or you can start after 12th Feb. I would say that you can start from Feb 1 because now it's a new cycle. There would be good accountability and you would be getting ENDs accordingly. So the chances of you sticking to it becomes better.
So this is a question, how to revise notes in less days than first read scheduled other than flashcard 8. Tirath said something. So basically, how to decrease the time for revising the same notes. I always keep on saying that when you do the first reading, you need to underline or highlight the notes. Highlight only those points which you do not know at that moment. If you already know now, definitely you will be knowing after 3 months. Clear? So whichever thing you do not know, mark with some pen or and highlight that. And next reading, read only that highlighted portion. And among that highlighted portion also, whatever you remember second time, that means that has gone into your memory. Now mark the other thing with some other color. So in the third reading, read only
Yeah.
that colored things. So in that
Uh,
manner, you will keep on decreasing the content.
100%, sir. Jaswant is saying, sir, stuck around 130 to 140 since last three GTs. How to approach from here? Some questions feel totally new in GT. Jaswant, see, this is a problem that many students have. If the GT score is plateauing between 130 to 140, what it means is that the things that are commonly asked in the exam, the PYTs that you have a good hold on, but certain topics where conceptual questions are being asked are missing. My guess is either medicine, surgery, or OBG would be the subject where you are having trouble. In case you are able to identify the subject, then do the mission classes for those subjects. Last year, Goga sir, many students who were in the same boat, and when we got one more month for our NEET PG, many students started doing Dilip sir's medicine in a day.
I
And finally,
remember that.
almost 50 questions came from those 23 hours of content. So medicine in a day, and soon we would be coming with surgery in a day. They are very high yield resources. Medicine, don't make the mistake of thinking that if I do patho, pharma, and physio and a bit of micro, medicine is taken care of. Doesn't work like that. NEET PG 25 had exactly 67 questions, right? So you cannot miss medicine. And Dilip sir has done great job with medicine in a day, 23 hours, and medicine quick revision videos around 48 hours. Do them. They're going to help you a lot.
Praveen Arohi is asking, my primary source is not cerebellum. How to
Mhm.
include cerebellum and END along with it?
So Arohi, Goga sir just answered. Say you are studying from any XYZ resource, but you want to follow the schedule. From whatever resource you studied, you can revise from there, but attend the ENDs. And for those subjects where you are not very confident with the existing resource, you can either use our mission classes or rapid revision videos. But where you are very comfortable, where you are able to do the answers, recall the answers well, just revise from the same place. That is okay.
So I think we have taken most of the questions. Huh? Anyone?
Uh, I think. While not using. Dr. Momo is asking something, sir. Is it advisable to keep flashcards plus BTR for notes with all the MCQ and GT while building concept with mission classes? समझ नहीं आया यार क्या बोल रहे हो?
Yes, this is
Anyways.
actually the questions which are being asked in the NEET PG nowadays. Too much.
Yeah, this is a good question, sir. How to keep at pace with job? So, sir, interestingly, one of our faculties went to AFMC, and there he met many majors and people who were in surveys, and they said that their problem of how to maintain studies, maintain pace was solved by mission classes. There were classes every day, and they would just come back from the job, watch the lectures, and that kept them, accountable also and kept them following a schedule. So, sir, if you are in the same situation, use it. The problem with the job is one problem is less time. Second problem is something keeps on happening at the job front. You are not in that frame of mind. किसी से लड़ाई हो गई, किसी ने कुछ बोल दिया, आप घर आके पढ़ाई कैसे होगी? So there the live classes play a very crucial role. So use them.
So, question to you by Manas. Sir, what can be practiced mentally to prevent burnout?
So see, what you need to remember is something that Goga sir already said, that please understand that certain things would go wrong always. Sometimes you would miss a day of lecture. Sometimes you would forget things. Burnout happens sometimes because we are putting too much of pressure on ourselves. I always say that entrance exam preparation is as much an academic pursuit as it is a pursuit of handling yourself better, handling negative emotions better. कभी कभी गड़बड़ होगी. There would be slip ups. That's okay. Don't think too much about the things that are going wrong, but keep on focusing on what can be done today. When we don't put too much of pressure on ourselves, things are usually better. Still, if you're finding difficult to study, you are in that stage of burnout, take a day off, take 2 days off. Try to shift from something difficult like reading by yourself to something comparatively easier like watching live lecture. You can also shift from watching lectures to doing questions. Whatever makes you feel a bit better, easy, whatever is easier for you, do that for 2 3 days, then come back to the schedule that is being followed by everyone.
So Vishnu Dev is asking, will the PDFs be provided? So I will like to answer that question. So
Yes.
definitely PDFs will be provided, and in your mobile we will make sure that you have another 1000 PDF apart from the 40,000 you already have, and plus around 50,000 more screenshots, and which you will never see. Because this is the perennial problem of all the students. They are looking for always screenshots and PDFs, just want to keep in the library, and they never open that library. So my idea will be, it's more important that you study rather than always looking for this and that, कि ये भी मिल गया वो भी मिल गया, बस मेरी गैलरी पूरी हो जाए.
Mm, well said, sir. Well said. All right. Okay. Yeah, the problems of notes and all we are aware of. GRG sir and I had a discussion about it. We'll fix it. You'll get annotated PDFs at time. Sauradeep Ganguly sir, will entire medicine be completed in this batch 3? As I saw only 8 days given. So yes, we had a long conversation with Dilip sir on this. That we have, of course, students love him and he teaches very well. But we want that we complete the content that is revisable also. So he would be making some changes also. And this time the class would be for 8 to 9 days only.
Can I
Rashmi,
follow
yes, you can follow the
the
schedule for
video?
INI May.
Obviously, we have already explained in the starting of this video.
Right.
Do.
So, guys, I think we have covered most of the questions. Now, finally, we just have to remember that wherever you are in the study process, whether you have covered everything, or whether you are starting or whether you are in between, there is something that you can do. If you are targeting May exam, we have created an END schedule. Please follow it. If you are targeting NEET PG and I9 November, we have created a schedule. Please follow it. Finally, following a schedule and following it with a discipline is what makes all the difference. There is no lack of resources in today's time. There are hundreds of resources, many of them very good. It doesn't matter. What matters is how can you use resources properly and how can you pace your preparation and how can you excel it in the end so that you give your best on the day of the exam. So that would be my final comments. Goga sir.
Definitely, the most important thing is you have to show every day. You need
Right.
to keep on studying on a daily basis. You can definitely schedule breaks every week, maybe 2 days, 2 hours, 3 hours, 6 hours. That keep a time that this day, this much time I will not study, so that
Hmm.
you always look up to that time, so that you are trying, you will be having a break. So we always
Right.
look up to that time, and our mind works better that way. So another important thing is, do not worry too much. Do not keep on thinking that मुझे ये भी करना है, वो भी करना है, वो भी करना है, ये भी करना है. So try to focus. If you follow a plan properly, you will definitely get the success. And most importantly, believe yourself, and believe your teachers also.
Well said, sir. So, students, we'll be staying connected in the Telegram group. Whatever other questions you have, you can always ask us. So, important thing is take action now, right? 29th, we are starting with the batch 3. 1st of February, we are starting with the END batch. It doesn't matter whatever you have done till today. Now is the time to follow one of these two routes. And one route ends in INI-CET May, the other one in NEET PG and INI-CET November. And we would be waiting for you guys to message us and tell us your great ranks. One last thing, Goga sir,
Hmm.
this is something that I have created again and again. So promise card, I will just read these things. Sometimes some students find it cringe, but it has helped hundreds of students. So I don't care about those who think it cringe. So in the coming months, I will work harder than I ever have. I will push beyond every limit. I may not control the results, but I will make sure this journey becomes something I proudly remember for the rest of my life. I fully understand that entrance exam preparation comes with ups and downs. I am prepared for both good and bad days. I promise. ये क्या हुआ? Slide गई क्या? Am I still audible and visible?
यस यस सर, स्लाइड भी विजिबल है.
Slide is also visible?
यस
My
सर.
slide is visible? Okay.
यस यस.
I fully understand that entrance exam preparation comes with ups and downs. I am prepared for both good and bad days. I promise I will not let a bad test, a bad GT, or a bad day affect my preparation. I will focus on the next task and keep moving forward with small, steady steps. Sometimes anxiety may convince me that I am forgetting everything, falling behind, or that the exam is impossible to crack. When that happens, I will remind myself that it's the anxiety talking, not the reality. And instead of overanalyzing, I will bring my focus back to the subject in front of me. I will not procrastinate. I will follow the mission schedule, do my classes, do my revision videos, complete the ENDs, midterm module, LNPYQ, and flashcards. Consistent MCQ practice will help me win. And no matter what happens, no matter how many obstacles I face, I promise to take my preparation to the last day. I will carry stupid faith in myself even when things don't appear to be going my way. And students, finally, this is a card that I'm going to send in our Telegram group. You will fill this card, you will sign this card, and you will take a printout and you will post on the wall that is in front of you. These things basically force you towards accountability. These small gestures are enough to, break whatever is going on today and force you towards doing something that is more meaningful. And these also give you a target that comes in front of you again and again, which also motivates you to work harder. So don't think these are small things. They have real life impact, they have strong impact, and finally they do make a difference. So study hard, students. A lot of time is left, optimal time is left. You do not have time to waste, but if you play your cards rightly, you can get a great rank. This is the time to study so hard that you end up even surprising yourself. And as I keep on saying that, take the preparation to the last day and you will get whatever you want. All the best. All the
Thank
best,
you very
guys.
much, guys, and all the best. So if you have any more queries, you can either post below this video or you can ask us in Telegram group. Thank you very much.
God bless you. Thank you, Goga sir.
Bye bye. Thank you, Praveen.